Welcome everyone to this week's edition of Health Corner. My name is Dr. Okpaka. I have the pleasure to invite Dr. Nitya Vishwanath, who is a GP in Southend Essex, who has a special interest in community gynecology. She is also a GP trainer. She's come to speak to us around some common gynecological conditions which women from the Black, Asian and ethnic minority group might not always come forward to discuss with their GP. You are welcome to Health Corner, Dr. Nitya.
Thank you for having me today.
Dr. Nitya, I know obviously you listened to my introduction. Yes. When being an experienced GP and you've worked in gynae, I know you've seen quite a lot. And there are some conditions women are a bit shy to talk about. If you don't mind, I'm going to ask you some questions and you share your experiences for the benefit of the public and for those women who might be out there looking for answers. Okay. So, sure. Do you mind telling me or telling the audience what women from the Asian or Black African or ethnic minority group who are in their 30s, 40s and 50s or 60s or older, some of the things they are shy to talk about? Then we can discuss it within the time frame we have.
Sure. Often women from the ethnic minority group find it very hard to discuss about very personal problems, including gynecological problems.
Yes.
So women in their 30s may experience concern about their fertility and how soon should they get pregnant. There's a lot of women who are high achieving and want to think about their careers first. So it's hard to make a judgment as to, okay, how late should I leave it before thinking of starting a family? And that's a common issue which we find in this generation in the last 10 years, where, women have matched up to men in terms of getting jobs which may be very highly paid. So they often have that worry about, when should I think of that?
Yes.
So that's a common thing which comes up. Another common problem which women may or may not want to experience and go and tell their doctor might be about their periods and period problems which they experience, especially when it comes to relationships and if it's affecting them in that way. That's again common in the women in their 30s coming to the doctor with, or not so common, but they do come quite late to discuss about that.
Okay.
When you come to early 40s, again because of the the change in fertility and sometimes a second relationship, because often we find a lot of women remarry and think about is it the right time to have a child? Yes. So that's another common problem which women may worry about but does not want to talk to the GP about as well.
All right, okay. Because I know we do see women coming because they're worried about their sexual life. Do you experience women coming to you complaining of dryness? Or,
so that's another interesting factor. So as the woman's body changes from your 30s to the 40s, there's still an expectation to have a reasonable personal life and intimacy as well, and the way they may find themselves might be quite different, because you might find changes happening to your body, and sometimes it's very difficult to talk about the vaginal dryness or the changes in their body, and you know, putting on weight, in how their breasts look like, how their tummy feels. They're all common problems, you know, post cesarean, you know, how your body changes, the scarring which may happen, problems with, you know, after surgery, if there's changes to how they look like and how they feel like. That's very, very intimate problem, which they don't want to discuss often.
Yeah, no, that's fine. Actually, you know, this is the first time someone is mentioning this, because, you know, women come to you as a doctor, and they tell you they have a headache, but they don't actually tell you what is causing the stress.
Yeah.
So, do you think that a lot of this may have to do with the attitude of their husband or partner, or is it because they've finished having their babies and then they think their body is changing? I mean, I know it's a broad topic anyway, but what do you...
I think especially relating to the ethnic minorities, the dynamics between the husband and the wife may be very different, and the expectations culturally may be very different as well, as to what to expect from your partner. And how open are you in your relationship, and how are you able to communicate with each other about, you know, there may not be even discussions about it. It must be just an automatic recognition that once you've had children, that's it, you're going to be taking on the role of a mother, and you know, going on that way. And then, you know, how much it affects them psychologically, what the expectations of each other are, can be quite different. So sometimes having very open conversations, you know, being able to actually understand each other in a different way, in an open way, can be quite helpful.
No, that's correct. And I think you touched on a very important aspect, because obviously you have, the man is busy working, a lot of the women are at home, not, you know, working. But do you think that is also common irrespective of the woman's education? Do you think the less educated ones feel this, well, will you call it isolation or odd? It doesn't really matter. It depends on the family dynamics.
Or sometimes it may also be related to how the women feels as well, because they may not feel confident talking about it. Since they feel a sort of responsibility towards the family and towards their husband, so they find it hard to actually bring that topic, because it's a taboo topic. That's how they were brought up with, and you know, often your mothers and grandmothers would have told you in a certain way, and it then becomes very hard for them to actually go out of the way and, you know, talk about it. And not always socioeconomically related. It could also be how you're brought up as well.
Family upbringing. Right. Okay. Right. So that's one. What about the men? I know obviously the thing that affects women might be something that is coming from the man. Is there any one or two things you think might be affecting the husband, which the woman is unable to do anything about? But it's affecting the woman. I mean, yes.
So I think, again, men in their 40s, even though we don't call it specifically menopause or anything like that, they do go through a difficult phase as well. I think, you know, both you know, it may be that they are, you know, stabilizing in their jobs. There may be, you know, things which they need to support. There may be health issues which are happening to them. Often people from African and Asian communities tend to have, you know, problems with diabetes, problems with high blood pressure. You know, all of the general cardiovascular risks tend to be much higher. And if that happens, it can also cause problems with erection difficulties and things like that, which may again affect the relationship of the couple itself.
Right. And obviously, if the man has a problem with erection or, you know, sexual problems, the wife is so helpless, isn't it? Or do they speak up? I mean, what do you think?
So I think it's a very sensitive topic,
Yes.
and it's a very difficult one to be able to
Yes.
have one-stop solution
Yes,
for
that's
it.
correct.
And often, we've seen in general practice when men approach a GP, it's often when they've hidden or tried to deal with it themselves for many years before they actually come to the
Yes.
doctor with. So when it becomes so hard for the man to actually come to the doctor,
Yes.
I'm sure it's affected their
Yes.
relationship in different ways. And actually it should be treated like any other medical condition because of the risk which it has in terms of high risk for heart attacks and strokes and often an indicator for almost like a first sign where you should probably get investigated with relation to your heart.
Yes.
And reduce those risk factors. So I think the woman also has a significant part to play if you are in a relationship where there may be difficulties with erection. So they can support each other and they can actually understand that this is a condition like you would treat a headache or a muscle pain or a shoulder pain or any of those problems. This has to be dealt with together, and that often has the best results rather than isolating each other and blaming each other for anything.
Yes, that's a fantastic advice. What's your experience around contraception? Do women from, we call it the BAME, Black, Asian, minority ethnic groups, are there a proportion of them that do not believe in contraception? Or
I mean, there used to be a generation where that was something which was almost like they didn't believe it, or there was lots of misconceptions around it. But I think the younger generation are more open to it. They are educated in a way, especially from schools and colleges. They have lots of information about it. So they're still, even though the uptake may not be as much, it's still better than what it used to be. And I think it's to, again, like with anything, it's to find the right thing for the right person. Be it a tablet, be it any form of contraception. It's to find the right one, and often that's a discussion which they need to have them with their GP to actually say, okay, what is it that you prefer? What are you expecting from it? How long are you wanting to be on a contraceptive for? Are you thinking of just delaying it for a few months? Are you thinking of long-term contraception? What may be your options there? So there's a lot of things out there, and some in the internet, some may be right, some may not be right. So it's actually choosing the right place to go to look for information as well.
Right. So it's helpful to obviously discuss with a health professional around contraception than just to keep it to themselves.
Of course.
And I know obviously we do have people from the minority ethnic groups coming to ask, oh, I've just had my baby. Is there any time, the best time to start contraception, or do I not start at all for 1 year, 2 years? What would be your advice?
Sure. So that's again a very common question which women come with, and often people are quite confused as to what they want to do, because some of us who are in their 30s would probably want to have children soon enough. So then it's a matter of deciding what sort of contraception may be best for them. And I think it's a common notion that if you're breastfeeding, then you might not get pregnant, but that's not the case. You could still get pregnant while you're breastfeeding.
Right.
So usually we start thinking of contraception from at least 6 weeks after your delivery.
Right. Okay. And now that's fine. On the other hand, a couple gets married now. People worry about infertility. When can we confidently say a couple is infertile?
Okay, so again, it's a very anxious issue among women, as to say, look, oh, am I going to be fertile? There's a lot of talk about polycystic ovaries and menstrual dysfunction and changes in their periods, causing worry about, oh, will I ever get pregnant? So I think for yourself to be calling or getting concerned about fertility, you should have at least had 12 months of unprotected intercourse with at least 2 or 3 days days, apart within the cycle,
Yes.
for at least 12 months to say, yes, you should think about, infertility may be a cause.
Yeah.
And even among them, if you leave it for a year and a half, about 90 to 95% of them get pregnant anyway.
Right, okay. And there's something else they ask. Does drinking alcohol or smoking for men or women, does that affect people's fertility?
So definitely it has a big impact on fertility, especially our lifestyle tends to play a major factor in your fertility, and sometimes we underestimate how much of an impact it has.
Yeah.
So if you do smoke and if you consume alcohol more than the required allowance, that puts you at a much higher risk of having fertility issues, problems with your general health and well-being. The quality of the eggs and as well as the sperm can be changed by the smoking and alcohol. So that's a big lifestyle change which we usually advise. So all the infertility services, they usually say if you're a smoker you won't be able to be eligible for NHS services. They usually have to stop smoking and provide evidence of it to be able to even get an option to get onto the NHS waiting list for fertility treatment.
All right, okay, yeah. And finally, obviously, we know that a lot of these women stay at home. What they eat or their body weight, does that play any role for the man and the woman at all?
So it's a very common thing that we've found nowadays. People tend to be overweight, and that usually causes alteration of their periods and their hormones, and causes what we call as anovulation, which means you don't produce the egg every month, which is the reason for you to be infertile. So in different studies they found if you reduce your weight by 5% or 10%, your fertility increases by about 40 to 50%. So it's a significant thing for you to consider if you're thinking of starting a family to be in your optimum weight.
Right, okay. So lastly, obviously, you mentioned polycystic ovaries. And is this common among the Black Asian community as well?
So it's a common, it's almost like a new illness which has come in the last decade or so, and it could be partly because there's more ultrasounds more easily available to pick up things, and Black and Asian community again, tend to have more body hair, and that usually is one of the things which can be associated with polycystic ovaries. Again, just because you have polycystic ovaries doesn't mean you're going to be infertile and you're going to have diabetes. It's a wide spectrum of illness where you could be pretty much normal and still have children as you would do, to the very rare instance where it can be quite severe, where you need hormonal treatment to actually be able to conceive.
Yes, thank you very much, Dr. Nithya. Viewers, obviously you've had the specialist giving advice on a wide range of topics that affect women across the board, but in particular, people from the Black, Asian, and minority ethnic groups. Some of the things I had to discuss, women come to the doctors, they don't know how to introduce it. But Dr. Nithya has made it a lot easier. And remember what she said, always have an open discussion. Don't go away. We're about to take a short break. When we come to the second segment, we're going to give you some more tips about how to address these problems. Thank you. Welcome back to this week's edition of Health Corner. If you're just joining, we have the pleasure to listen to Dr. Nithya Vishwanath, who is a GP trainer and a partner in Southend Essex, and she has special interest in community gynecology. In the first segment, she's mentioned the common health condition affecting women, especially the people from the South Asian, the Asian, the African, and some ethnic minority groups in the UK. Some of these are difficult for the women to come to their GP and discuss, because it's so sensitive. Sometimes they don't even know how to present it. It's a very difficult topic, but she's made it simple. So in this segment, you're going to listen to the specialist talk about some of the things to do to overcome any obstacle to having a discussion or having a productive intervention to some of these problems. Dr. Nitya, I know I call you Dr. Nitya Vishwanath. Yes, thank you for your insightful comments and advice in the first segment.
Sure.
Now, these women come to you, they've got this problem, and they're able to open up. What would be the advice, especially starting with the poor sexual function for them or for their husband? What will be your advice? How do they start addressing this? I mean, obviously, the advice is individualistic, isn't it? But at least some advice to help them to confront this.
So I think it's to actually understand what may be going on is very important. So it may be related to their age as well. So if you are thinking of women who are under the age of 40 and having problems with their periods, especially if you've not had a period for a long period of time, that's something which I would probably say is a red flag, and you should see your GP as a matter of urgency. The reason I say that is there may be problems with your hormones which you want to look at sooner rather than later. And if you are in the age group of 40 to 45, and if you're experiencing problems with your bleeding, problems with hormonal imbalance and mood swings, which are quite common, it's again something to have a discussion with your doctor to find out what may be the reasons for it. It may be that change in hormones, it may be early onset of menopause and things like that. And often you find when people hit the age of 45, we call it perimenopausal age. From 45 to 55, you go through menopause. All of us go through menopause as women. The average age of women go through menopause is 51. So even though it may be 51 that you completely stop having periods, you could experience symptoms of menopause from 45 onwards. And it may be different ways that it can present. It could be vaginal dryness, it could be hot flushes, it could be sweats. It could sometimes be as vague as just headaches or palpitations and symptoms like that. So sometimes it's just a matter of recognition that this may be related to your hormones. So having a discussion with your GP would be quite useful to actually find out what's actually going on. And sometimes it can be that you feel very distant from your partner because you lack your sexual drive, which can happen in women in their 40s, where the hormones vary from one another. So that's a common problem which can occur, and there can be things which you can do about it. So actually looking at how your lifestyle is. So if you're somebody who drinks a lot of alcohol or smokes, that can affect it significantly. Or if you lack exercise, that can be another reason why you may feel like that. So your hormones may be much more imbalanced. So actually having regular exercise in your diet, looking at what you may be eating, looking at how can you control your weight, looking at the the mental health aspect of it. How is it affecting you at work? Are you productive at work? What is it that you can do to help yourself through this period of time? Actually recognizing it is the most important thing.
The recognition is very important, isn't it? And I know it's difficult the advice goes for the men as well. So if a man has a problem with his sexual function, is there a treatment out there, or is that help from your experience?
Yes, I think the first step would be to actually have a consultation with your GP to actually go into more detail about what may be the reason for sexual dysfunction. It may be something which is related to your genital structures, or it can be something more generic, like it could be related to your blood vessels anywhere in your body, and one of the blood vessels which causes problem is leading to erectile dysfunction. So actually finding out what the root cause is very important, because it can have a big impact on how your confidence is, how your mental health is, what your relationship is with your partner. So that has something which needs to take priority to actually investigate and find out.
Right. So does sleep affect people's mental health, both the women and the man?
So in terms of sleep, it's quite a tricky one, because usually if you're somebody who's unable to sleep, that can be a sign of mental health problems. Or we find that when people are depressed or anxious, the first thing which may be affected is sleep. They often find it interrupted, or sometimes very difficult to fall asleep, and sometimes waking up early in the morning can be very common problems which you find associated with depression. And sometimes if you are somebody who's very stressed in your work and sleep less, that can affect your ability to concentrate, your relationship with your colleagues, because you're almost on the edge at every time. You may be short-tempered. So it has various effects, and there are studies which says that if you're consistently sleeping less number of hours, you're increasing your risk of death from whatever cause. So that's another important thing to think about, to actually see from a general well-being aspect about your sleep, and how you look after yourself.
Yes, and talking about general well-being, I know we've talked about what they eat and how active they are. Do you think the women, or men as well, that stay at home and do nothing all the time and feel themselves isolated, do you think that has a bearing on their physical and mental health?
Yeah, I think certainly anybody who feels isolated, who is idle, tend to have more worries and thoughts about their confidence. It certainly will have impact on your weight as well, because the more sedentary you are, you tend to put on weight. There's more chance for boredom, and eating habits can be quite erratic as well. So you could be eating more because you're bored from it, or that's the only pleasurable thing which you do, and often you resort to fast food and things which may be high caloric one as well. So actually that has a long-term impact on how you might be. So actually even if you are stuck at home, which we all were during the pandemic, to actually look about innovative ways to actually trying to keep yourself active. Can you watch a YouTube video, or a Keep Fit class which is online to join, to actually try and keep yourself active? Can you have online communities where you can share how much exercise you've done, or what is your goal for the next week, what kind of a run can you do, what's your next goal to achieve, hobbies which you can develop, which can be quite healthy and will be able to communicate with each other. So joining a club can be quite helpful, a cycling club, or if you're near the sea, you can go for a boating club, or things like that.
Okay, fantastic. And can that in any way improve the person's fertility? I mean, for people who are having problem conceiving?
Yeah, so this is the general advice which an infertility specialist would give the couple, is to actually think about your lifestyle changes as the first goal to think about if you're concerned about your fertility. So for men, usually we say to stop smoking and to reduce your alcohol intake. If you can completely give up, that would be really helpful. Think about your sleep. Think about how you keep yourself. What is your well-being? How stressed are you? Because your stress hormones increases your stress levels, and then that has an impact on your sperm count as well. So all of these are things which we tell men to be looking at. And from a women's perspective, it's exactly the same. We ask to stop smoking, reduce your alcohol intake, healthy lifestyle, become active, half an hour for at least 5 days a week, 150 minutes of exercise. Trying to lose at least 5% of their weight, like I said, increases their fertility significantly. So all of these can be things which you can do to help your fertility yourself.
Oh no, that's fantastic. And one of the viewers asked, if I'm pregnant, am I is there any exercise I should not do, or is pregnancy a barrier to keeping active? What would be your answer?
So I would go by what you feel comfortable doing, rather than say prescriptively say you should do these exercises or not, because before the pregnancy itself, different women might be at different levels of fitness, and it's to carry on with that level of fitness, or in fact improve it. So regular walks can't be harmful in any way. There's pregnancy specialist yogas which you can do. There's Pilates which you can do. There's stretching exercises which you can do. There's some talk about certain stretches and specialists keep fit classes specifically for pregnant women. So they can be something which is made available through your midwife, and your local community groups have groups where you can join as pregnant women to do them together.
Right. Okay. So from what you're saying, there's no barrier. Pregnancy is not a barrier to keeping active, is it?
In fact, it is one of the times where you would probably want to optimize your weight, because your chances are that if you are overweight, your chances of diabetes is going to be much higher in your pregnancy. The chances of high blood pressure is higher for people who are not active at all. So keeping yourself active through the pregnancy reduces your risk of having clots in your legs, reduces your risk of having problems with diabetes and high blood pressure. So that's very helpful, and keeps your muscles and your back supported as well.
Okay, fantastic. And that also helps the mental health, isn't it?
Definitely, because women can go through a lot of hormonal changes when you're pregnant, and sometimes it's isolation, sometimes it's seeing the same person alone, sometimes it's, especially in COVID times, you've not been able to go out, so that's been a major thing as well. So the exercise and keeping yourself active increases that natural happy hormones in your body.
Yes. No, that's fantastic. So obviously, viewers, you can see the specialists have said this pregnancy is not a barrier to keeping active. So whether you're pregnant or you're not pregnant, please keep active, and then that fights social isolation. Now, there's one of the conditions women usually don't like to talk about. You talked about having had their babies, and now they're going into menopause. You have the hot flushes, you have the mood swings, From your experience, do you have women coming after menopause to, tell you they want HRT from the minority ethnic groups, or do they just stay home and,
So it has been a difficult issue to talk about for women over the years, because they feel it's almost like it's a sign of growing old, so they just accept it and go through it in silence, suffer through the difficulties which you go through because of the changes which happens naturally. The good thing is that we have so much medication and facilities for it to be much better experience rather than go through a difficult way, especially now, because women are working much longer into their 70s even. So there's a good population of us who actually are affected significantly by menopause itself, and actually consider that as something which you have to go through. So actually, I want to bring to the speakers or to the audience the importance of not having to suffer through it, because there is so much help available to actually make it an experience which you could tolerate, or you could do something about, like you would treat a chest infection or a headache.
So menopause, hot flushes for menopause, there's always support and treatment out there. The person shouldn't look at it as growing old. Now, people do have joint pain from osteoarthritis. From what you're saying, keeping active does help these conditions. I mean, we have women who come because they've not been active. The joints are all stiff. They cannot, and that even makes them not to engage in any exercise. Do you think people with arthritis should engage in some form of active life?
So arthritis is a thing which can occur, as your body changes with regards to wear and tear, and it doesn't necessarily mean everyone of a certain age will get arthritis. Some of us do tend to have less amount than others, and again it may be related to your weight and your lifestyle and things like that as well. But what we've found is when you have arthritis, it all the more becomes much more important for you to keep yourself active, because what happens is that because of the arthritis, the muscles can actually go into atrophy if you don't work your muscles, and then you end up having more problems, like difficulty in getting out of a chair, or having knee pain if you're going to stop getting upstairs. If you can't, then you're going to have much more difficulty doing that. So keeping yourself active, doing exercises which nowadays people recommend even doing weights to whatever extent you can do, even if it's a 1 kilogram dumbbell kind of thing, to actually help yourself to keep active. It helps with your muscles and bone strength as well. Especially post menopause, you tend to lose bone strength because of the lack of hormones. So keeping yourself active through exercise is very important to keep control of your arthritis as well.
That's to the point. I think you're very right. So what you're saying is women who are in their postmenopausal should not see that as growing old. They should have active life, and that helps them to not to get all this arthritic pain that now affects them physically and mentally as well. Because when you're in pain, you tend to be down about different things, because you're not able to do things as you would do. You're not sleeping very well. So all of those accumulatively makes yourself sad and depressed in different ways. So keeping yourself active means you're able to do things, and you become confident in doing things over a period of time. And keeping yourself active is a very broad term, but actually making it more simple as to what may be things which you can do, and it may be different for different people. So it doesn't mean that if my neighbor is going to be climbing up the the next marathon, I may not be able to do that, but I can go for a walk for 15-20 minutes, and that's perfectly fine. So keeping yourself active can be to what level you can do, and actually pushing yourself to the limits usually helps. And you mentioned weight loss as well. I mean, the things we eat, that does have an impact. Obviously, would you advise women not to eat sugary things or fatty things? What would...
So again, over a period of time, we've noted that there's a lot of fat diets. Going to starvation, going to only protein kind of meal. So actually, they may be sustainable for a period of time, but they're not usually sustainable long term. So looking at how you can modify your diet to a level which is acceptable, but at the same time healthy, is very important. So actually aiming for a lot of greens on your plate, looking at healthy options for protein. If you're vegetarian, then looking for vegetarian protein. If you're non-vegetarian, then you can think about meat or fish, according to what you think may be appropriate. But actually reducing the amount of carbs in your diet can be quite helpful to reduce the risk of having diabetes and putting on weight.
And I think advising women, from what you're saying, people should cook their meal at home. I know a lot of the Black, Asian, minority ethnic groups, they cook their meal at home. But there's this tendency that some people refuse to cook and then now depend on takeaways. Is that a good idea?
So the problem with takeaways is that you don't know what is going into it and how much of it is going into it, and often when there's extra salt and sugar, that makes the food tasty, and that the seller wants to sell it, but if you're cooking from scratch, you exactly know how much of it is going into it. So it's actually a good idea, even if it's simple meals, to actually try and prepare your meals. If you can prepare what you're going to be having for the next week, you can budget yourself. It's a way of conserving money as well as conserving your health in an easy way.
Exactly. So sorry to bring you back to taking walks. I know some families don't have money to register in a gym. They can take walks, isn't it? Like how long should they take the walk for is it every day, every week? Or?
Yeah. So I think it'll be a good idea if you've never walked, if you're somebody who has never walked, to start with, how you see, say, even if it means 10 to 15 minutes to start with, but actually making it part of your lifestyle, making it a habit so that you can increase it. So how does 20 minutes see today? In another week, you might be easily able to achieve 20-25 minutes, but at least a good pace of about 30 minutes, at least 3 to 4 times a week to start with, may be a good option. But if you can do it, more than 5 times, that would be ideal.
Right. Okay. And I know a lot of communities are closed. In what I mean by that is you have people from the Asian community, not all of them, but some women will not be able to open up unless they see someone from their community. Do you encourage people to try and talk about their problem, even if to families or to their health professionals? What would be your advice? Because some people just stay in and bottle it in, and it can be very stressful.
I think we have to recognize that is a real thing. Sometimes it may be a language barrier. Sometimes it's about how you feel about yourself, how you may feel that you are the only one of your color, or you are the only one from your community, and it can be quite scary and difficult to do that. And often your GP can be a good person to actually speak about that, because you do have services in the community called social prescribers who may be able to support you to find a community who you feel more comfortable with. Or sometimes it may be through them that you may be able to find people who may be befriending services. There are services out there who you can speak to. How can you be part of the team, and how can you be joining a charity, or how can you be integrating well into the community? And that's often a good place to start with, to go and see. Or even park runs, or there may be community things which are happening where you could go and try. Your local church may be a good place to go to see if what may be happening there, and start from there as well.
Dr. Ditya, you've done fantastic. Thank you very much for all your advice. I'm sure the viewers have gained a lot today. You've talked about a wide range of complex issues in a very simple way. I can tell you, viewers, you've listened to the specialist who said, talk out. Share your stress with family members, with your husband. Don't keep it to yourself or to your community, or always call your GP if you have any health issues for yourself. And I encourage you, she's encouraging families to eat at home, not rely on takeaway. Be mindful of keeping an active life. Regular exercises. You can register at the gym. You have dumbbells you can use to fight arthritis. That you're a woman or you have had all your children does not mean you're old. You can always live a normal life by looking for support each time you need that. And remember, she also says that keeping an active life helps you not just physically but also your mental health, and it makes you a lot happier, and you keep yourself happier and your family happier and prevent diseases. So Dr. Ditya Vishwanath, we thank you for coming to Health Corner this week, and I know that anytime we call you, you'll happily come and share your specialist knowledge. And thank you very much for coming. And viewers, thank you for watching. Stay tuned, and obviously log in next time we present new topics. Thank you. Bye-bye.